We are 40 minutes gone past the hour of 6, and you're still watching Twilight after discussing organic use of preservatives in agriculture. Time for us to talk a little health, and this time we are looking at how well and how far we have come with the universal health coverage scheme in Cameroon. Remember, this is already in its first phase in Cameroon, and there's some modalities around it, but first we will be looking at what this scheme is all about. We've been hearing about universal health coverage in other countries, and recently in Cameroon there have been much talk about it, and we've brought in those quite concerned about this scheme to elaborate and give us important points to take home. And on that we welcome Ewi Pamela Mbi, who is unit head in charge of managing complaints within the universal health coverage scheme in Cameroon. Welcome.
Thank you.
And you came along with Dr. Nunji Simon, who is heading the communication department of that scheme. French speaking. Bonsoir et bienvenue.
Oh, okay. Merci beaucoup.
All right. So we'll be talking practically about the universal health coverage scheme, how far. And this scheme was announced to the Parliament in last year, December 8, 2022, by the Minister of Public Health when he announced that the first phase of this project will go in force this 2023, and that has been so, and we want to just keep up with how much and how far they have come with it. And to that, let's get vital information from the head of the communication unit, Dr. Nunji Simon. Bon, si on doit parler de la couverture santé universelle, qu'est-ce que c'est?
Okay.
Thème compréhensif pour les Camerounais.
Ok. Vraiment, merci pour cette question. Donc, vraiment, de manière succincte, il faut comprendre que la couverture santé universelle, en abrégé, donc CSU, permet aux populations de pouvoir avoir accès aux soins de santé de qualité et en minimisant les coûts. Parce que vous savez, lorsqu'une personne est malade, souvent la frontière entre la personne qui est malade et le fait de voir un professionnel de santé, c'est la barrière financière. Donc la CSU phase 1 vient pour minimiser cette barrière financière, pour permettre au maximum de personnes de pouvoir avoir accès aux professionnels de santé. Maintenant, globalement, la CSU phase 1, vu que l'un des principes forts de la couverture santé universelle, c'est le principe de progressivité, on a, sous l'impulsion de notre hiérarchie, on a commencé avec un panier de soins bien précis, en l'occurrence dont les enfants de 0 à 5 ans, les femmes enceintes, les personnes sous dialyse, les personnes qui ont le VIH-Sida, la tuberculose. Concrètement, ça veut dire quoi? Lorsque un enfant de 0 à 5 ans est dans la plateforme CSU, maintenant, lorsqu'il se rend à l'hôpital, il ne paye plus pour la consultation dans les centres de santé intégrés, CMA, hôpitaux de district. Là, voilà une révolution qu'apporte la CSU phase 1. Avant la CSU phase 1, les dialysés, les personnes sous dialyse dépensaient 5 000 francs la séance, 10 000 francs la semaine, 520 000 l'année. Maintenant, avec la CSU phase 1, une personne qui est enrôlée paye juste 15 000. Donc, on voit comment la CSU phase 1 vient aider les populations, notamment les personnes qui ont l'insuffisance rénale, qui nécessitent la dialyse. Ils économisent 505 000. De même également, les femmes enceintes dans les régions de l'extrême nord, Adamawa, est, sud, qui sont enrôlées dans la CSU phase 1, payent juste 6 000 francs CFA pour pouvoir suivre leur consultation prénatale jusqu'à l'accouchement, même s'il y a une complication lors de l'accouchement qui va nécessiter la césarienne. Donc on voit vraiment les nouveautés fortes qu'apporte la CSU phase 1 dans notre pays.
And today we understand that there have been 20 enrollment centers across the nation, am I right? And when you look at the progression in terms of enrollment, like Doctor just said, it is, for this first phase, it is open for pregnant women and children less than 5. Now, maybe you can come back to that and elaborate in the English language and also tell us how well this first phase is unfolding.
Okay, thank you once more for giving me the floor. Apart from what Dr. Nuji has said, he has given a clue of what universal health coverage is all about, and the different services that they are offering, and the different targets that are concerned. Talking about focusing on children or on pregnant women, the unfoldment is progressive, as he rightly said. because we try to follow the instruction of the President of the Republic, which says that we should start from somewhere and progressively we'll get there. What is left to be done to an extent is to reinforce mobilization and reinforce also communication that sensitize the population, especially this target group for pregnant women and also for children 0 to 5 years to be able to get enrolled into the system so that they can effectively benefit of these services that are supposed to benefit under the universal health coverage phase 1.
And how far is the phase 1? When are we expecting this to come to a close, and what's next after phase 1? Is it that we are going to include the entire population? Because when you look at what you cover is limited to some diseases, I guess.
Yeah, it's limited for the moment, but we are believing that with the effort that we are going to reinforce, we are going to probably get there. We are going to scale up.
Okay, so how far with the enrollment, and you as the head of the unit in charge of receiving complaints, what are the complaints so far?
The complaints so far, there are many, but they are mostly technical.
Okay.
If you can say like that, because complaints that are coming that we are receiving as of now, they are related to the technical aspect of it, maybe mostly on enrollment, the platform that they need to still review, maybe sometimes connection problem, visibility at the level of the suburb. That's where the main difficulties are coming. And also a kind of complaints that we receive that actually sometimes related to trials, an attempt for people to maybe try to request for a certain sum, because we have had reports like that, maybe from Littoral and also in the north and even in the east, where we had to investigate that maybe the enrollment agent trying to request for a sum of money to be enrolled, especially for dialysis patients. I think we got something like that a few weeks back, and we tried to investigate and we discovered that it was just a rumor. Actually, the ad was not really posted, so we ended at that level. But as of now, we can say that complaints are really focused on the technical part of it.
All right. And gradually you are getting everyone on board.
Yeah, we are getting everyone on board. What we are doing is that we are trying to set up a mechanism already, since we know the toll-free number.
The toll-free number.
Yeah, the toll-free number, that's 1510. That is already well known. That is all we are using. That if you notice any fidgeting in terms of demand to pay for services that you are not supposed to pay, because the policy says that the services are being subsidized by the state, so beneficiaries are not supposed to pay, especially the general population, especially those that are living with HIV, so they are not supposed to pay a ticket because the state has already taken part of the charges. They have taken the charges because antiretroviral drugs are free for HIV patients, testing is free, and all of that. In short, all the package. So it sounds funny to see somebody, maybe an HIV patient, coming and maybe to pick up drugs, and you are requesting the HIV patient to pay some money before you give drugs. So we are working on all of those things, and we use the mechanism of the toll-free number. They can get to us, as well as a different unit head at regional level. They are working in collaboration with the district head, and also with the region, to make sure that they capture such information in the community and they share with us for necessary action to be taken, so that will stop the
practices. All right. Dr. Nudji, dites-nous un peu, est-ce que la population est au courant de ce que vous faites?
Okay.
Parce que c'est ce qui compte. Il ne faut pas avoir juste les mécanismes en place sans savoir si le message est relayé.
Non, on peut répondre par l'affirmative que oui, la population est au courant, puisque tout à l'heure, lorsqu'on regardait encore les chiffres, au Cameroun, on est déjà autour de plus de 1 500 000 personnes qui se sont pré-enrôlées dans la CSU phase 1, et les personnes enrôlées, nous sommes autour de 800 000. Donc ça veut dire que la population est au courant, mais sauf que lorsqu'on regarde, on est toujours dans une dynamique où on veut s'améliorer, on veut aller de progrès en progrès. Ça veut dire que on souhaite que davantage les personnes puissent comprendre ce qui se passe, que les personnes puissent traduire leur adhésion par les pré-enrôlements, les enrôlements, parce que véritablement la CSU phase 1 vient pour aider, pour soulager plusieurs problématiques de santé qui auront un impact certain sur les indicateurs de mortalité dans notre pays. Donc, vraiment, les populations sont au courant, mais on profite des émissions comme celle-ci pour pouvoir libérer encore la bonne information et on reste dans l'expectative que davantage les gens vont pouvoir prendre le cran en marche. Et si vous voyez, je vais prendre peut-être l'exemple des dialysés. Actuellement au Cameroun, on est déjà autour de 97% des personnes qui ont une insuffisance rénale qui nécessite une dialyse qui sont dans le système CSU. Okay. Donc le message y passe, mais là où on trouve qu'il y a encore des gaps vraiment à combler, c'est les enfants de 0 à 5 ans. Parce qu'on est autour de 15%. Les enfants de 0 à 5 ans, c'est pour ça qu'on profite pour dire encore à nos parents et à ceux qui nous regardent de pouvoir veiller à ce que les enfants de 0 à 5 ans soient dans le système CSU, donc puissent se préenrôler et s'enrôler. Parce que très souvent, on va voir des mamans qui ont des enfants, c'est difficile, mais la maman essaye de se battre avec ses moyens. Et après, elle vient avec l'enfant à l'hôpital lorsqu'il est en train de faire déjà des complications d'une pathologie qu'on pouvait gérer si elle était arrivée très tôt. Pourtant, la solution de la CSU phase 1 est là, qui permet à la maman de pouvoir voir un professionnel de la santé gratuitement.
Okay. Well, thank you all very much. It's really important that everyone gets involved. It's an advent that should benefit every Cameroonian. The government is starting with pregnant women and children below the ages of 5. Like we earlier said, there are 20 enrollment centers in the country and across all the regions. So you do well to go by. If you haven't had enough information on this platform, no harm, just go straight to these enrollment centers and I'm sure they will get information on how to be part of this platform.
Yeah.
Thank you both and looking forward to having you again. This is not the end.
Okay.
All right.
Thank you.
Let's take a break. We'll come back. We'll be receiving Aisetu, who is advocating for women